Greetings, viewers. Welcome to Women of Authority Africa with Noluthando Ngcizela Kalembede, Intombi kaXesibe uMolokazana Wondima. Thank you for joining us tonight. We have a very special guest tonight, Dr. Jabulani Moloi, who is a fertility specialist, a gynecologist with a vast experience of over 20 years. He's one of the most renowned fertility specialists in South Africa from the Joburg Fertility Center. Dr. Moloi, it's so great to have you tonight. How are
I'm
you?
okay, and you, Noltando?
I'm very well. Doctor, just to be quick, because we are supposed to start at 7
Okay.
o'clock. We are just going to delve on the subject of fertility and infertility in men. I would like to start by asking, what are the statistics of infertility in men in
Yeah.
general?
In general, actually, we're seeing very shocking statistics that we see more and more men with infertility problem. Before it was around 30%, now it's almost 50%. Therefore, it's equal almost to female infertility in numbers or in prevalence. We don't know what is really the cause, but we're seeing more men with something like azoospermia or low sperm count or any abnormalities we shall probably go into in details as we go on.
Okay. Women, the statistics, how are they?
Yes, women all along they were actually leading with the statistics, but I think probably they've reached a stable. They are not. It's not going up. As I said, you've got an incident of about 20 to 30% in the whole population is 15%, but women contribute to 30 to 40% of all infertility, problems or challenges. Then that will, combine it with men as well, which also contribute a larger proportion, almost equal like men. Then it's almost 30% combined. Therefore, the combination of two, in other words, men and women, also contribute another 40% to make 100%. Therefore, I would say both men and women contribute equally as far as infertility is concerned, because it's been actually low with men. I don't know, because maybe with the invention now of fertility specialists, which are actually looking at that, and the urologist per se, it wasn't their, a keen field. Hence, the fertility or the gynecologist have actually looked into that field and now trying to help men, because we need to, to have that couple get into pregnancy. But we're picking up a high incident as well of men having that problem. Maybe we may think that maybe we know it may be nutritional. That's one thing for sure. Maybe the diet have changed. We think maybe the diet have changed in a sense that we're seeing a lot of phytogen or estrogen like supplement in most of our food, and that may be the problem. As you know, that may affect the sperm production. That's one factor. A lot of men as well with the whole the global world problem of weight gain or obesity. Then we see men as well with obesity having also problem with the sperm or the sperm quality or sperm motility or sperm function. As well, we're seeing that maybe lack of activity and even exercise may be also a big problem as far as men is concerned,
Bonus.
and that may affect their sperm.
Okay. We lost you there for a couple of seconds, but we may continue. I wanted to find out, as you spoke about the nutrition aspect of men being infertile, how would you advise men to take care of their health? Because in most instances, it's women that go and seek help because men don't assume to be infertile. In most cases, the women are the ones that go for checkups and all of that. It's very random for men to go and check their fertility status. How would you advise men to take care of their health and to also increase the sperm count when it comes to their fertility status?
Yes, that is true. That is probably what we call probably a cultural aspect, where in any couple which got married, the first person actually to be looked at, that over a year or after a year, what was happening, what is not happening, or we're not getting to pregnancy, then the woman blame culturally. But we're seeing a slight change because now families are becoming more very important. There are four things which are very important as far as men is concerned. The first one is really to look after the diet which they are consuming. By that we mean healthy diet, a diet which is less of animal fat, a diet which is more nutritional like nuts, and more, they move away from this fast food. It's very important. And the other important thing is alcohol consumption of alcohol. We remember I talked about estrogen and phytoestrogen. We believe most of the beer and many other alcohol may be having a high estrogen, substance, which may actually, act like estrogen to a woman, to a man, and then reduce their sperm production. The other important thing is a lifestyle, especially exercise. We encourage that should be actually important to men and even to everybody. And the fourth one, which I'm thinking as well, we're picking up high, is that men tend to smoke or smoke in high numbers, and that as well affect their sperm count directly. And those are the four factors I would say men should look at, and especially if they have any form of difficulties in getting pregnant. If they try for a year and nothing happened, the lifestyle change should be the first one to look at.
Okay, okay. Now, coming to women, in most cases, we find that women only get gynecology, go to gynecologists or go for medical help only at an advanced stage in age. They don't check from the age of 18 going upwards. It's only around the age of 25 to 30 that most women start taking care of their health when it comes to their wombs and their uh, their health.
Mm.
Um, what would you say is the most disease that or sickness that is affecting women mostly? Is it endometriosis, or is it fibroids, or what is going on? And how can women detect when they are going through such? Because most women go through their menstrual cycle with pains having gone through them for years, and they think absolutely nothing of them. So now, how would you advise women on that
Yeah,
aspect?
I think Africa as a whole, including South Africa, even in Asian countries, I think fertility specialists actually been looked at very late, and even the general gynecologist also take a smaller part to refer patient in time to us. But now I would say the important rules we should look at. I would say every time a woman actually start menstruating and having terrible pains and probably taking 2 to 3 days not going to school, that patient need to be assessed properly, probably need to be seen by a gynecologist. And if nothing's
From
from a
young
younger
age?
age, when you started menstruating, heavy menstruation, severe pain, and a child probably every month has to stay at home for 4 or 5 months as a little girl and cannot go to school. That's actually the first sign that something is wrong. And then we should look at those, because now as a gynae and so forth, we've got treatment which we can give, especially for pain, so that those women, they actually can have a quality of life, go to school, and then achieve what they need to do. Then later we can look at the reproductive side of the home. That's very important. In so tuberculosis lumi, I can't remember what they say in other languages. And then when you look that lumi in detail, it's actually endometriosis. because we don't pick it up early. In whether in Europe, whether it's America, or even in Africa. In Africa, it's even worse. In Europe, they take 10 years for them to diagnose a woman with endometriosis. Therefore, if that can be done early, because now as fertility specialists, we're trying to concentrate at an adolescent endometriosis. We think if we can pick up those problem early in those women, we'll probably guide them through so that later in life, after at 30 or after they get married, then when they seek help already, they are diagnosed and they're put in proper treatment so that endometriosis doesn't actually move on from first stage 1, 2, 3, and 4, which is what we're picking up those women at stage 3 and 4, and it's already late. Now, women, I would say the first thing is that they have to go on a checkup on a yearly or every 3 years, especially after 21. And the first thing is to really to do a pap smear and do a proper gynecology ultrasound to look at all, the productive system is normal. There's no cyst, there's nothing like that. Then, be put on proper treatment and then be looked after and followed yearly like that. Now, the first problem with infertility, which we have to admit, is that, as I said, infertility and even endometriosis, we diagnose them late. And as you said, women present to us late. But there's what we call an ovarian reserve. In other words, a woman is born with her eggs. Immediately you are born or you're growing in your mother's womb, already you've given your eggs already from your mother's side. In other words, the highest number a woman have eggs in life is actually at 28 weeks in the womb, which you're looking some more than 10 million eggs. By the time the woman is born, you're talking already of 10,000. By the time the woman is around 35, you're talking already reduced to close to about 1,000 or less. Therefore, it's natural for a woman for eggs to every egg reserve to go down with age. That those are the important thing which we have really to inform women about, and especially now there's a few things which are happening in women. The first thing, a long time ago, women never probably go to school, as we say. They were not, school was not a primary thing. But now with change and and many things, women actually the forefront. In other words, they go to school, they have to go to universities, they have to do their masters, they have to do their PhD, then they want to settle. In other words, they buy a house and everything. And you find that that is around 32 to 35. Already their egg reserve is actually coming, very down. Hence, we, as fertility specialists, we say, no, we understand that things have changed, but we have to advise women and actually educate them that if that's what you want to do, there's also something we can do. Now, we have in most of IVF center in South Africa and probably in the world, what we call the egg banking, where they can, go through the process and they bank their eggs, bank 20, 30 eggs or something like that. Then they go through with their life, finish their PhD or whatsoever they want. At 32, 34, they come in and then they can plan their family. That is possible, and it's normal, and it can be done. Now, the other important thing as well in Africa, which is very important, because I think in Africa we still have a lot to do, whereby we're not seeing those women who actually have some cancers, because now immediately you diagnose a cancer in a young woman of 12 years, 16, none of the oncologists will say, we don't know whether you want to have children at 20. Everybody's shocked about, 16, 18 with a cancer, either of the breast or cancer of any, let's say, leukemia or any other form of cancer. And everybody take this little girl straight to chemotherapy, straight to radiation. By that time, they kill all the ovaries. And the woman, definitely get cured, or the cancer is controlled. She still have another 30, 40 years to live. Now she can't have children. Then she's faced with an infertility problem. Then we're saying no, we should be able to work as group, as doctors, and we should be able to pick up those little girls at 16, 18 diagnosed with cancer, then quickly take their eggs before they go freeze them and they can go to do the radiation or chemotherapy for their cancer. Then later in life, they can plan to have children. And so that also happened to men as well. The same thing happened. We've got many young people also diagnosed with cancer, but as it's not the fault of the doctors, as I said. It's just technology is going fast, but I think we're not communicating that. I also blame the fertility specialist. We're not spreading the message enough so that everybody should know that somebody young get cancer, they should think about what is this man, gonna do in the next 10 years, 20 years. Is there anything which will affect the, testicular production of sperm? And then we can always take the sperm and save. For a man, it's very easy. We said he must come 2, 3, 4 times to ejaculate and give us the sperm and then go on with the chemotherapy or radiotherapy. Those are the things I say in Africa we still have to work. There are organizations, of course, we're working together with many so that we can see those and then we can try to help as much as we can. Yes.
Oh, no, doctor, you know what? You've just given me information that I didn't know, that from birth already there were already eggs. By the time you're born, you've got already 10,000. That's like news to me. I've never even thought of that at
Mm.
all. So you spoke about the diminishing in eggs,
Yes.
right? And the banking of the eggs. Is it something that is available only for private practices, or is it something that's available in a general
Yeah.
hospital, or
Mm.
is it required to be done by
Yes,
specialists?
it's unfortunately that is true. As you know, the abnormality, especially in South Africa. I don't know in many other African countries, but I think it's still a big problem. We don't have a universal coverage as far as health is concerned, which is not a good thing at all. Unfortunately, what I'm talking about, whereby the banking of eggs is only available in the private sector. Although we have good, fertility centers like Stellenbosch in Cape Town or in Western Cape, and we've got Pretoria as well with a good fertility, center as well. But egg banking is not really a priority, I think, for them for now. I think maybe this kind of discussion, it will make us as well as doctors and so forth try to get the government today, because it's this care where it's very skewed. In other words, we're saving something like 10% of South African can only afford that and have it. It's very unfair indeed. But I think with time, those are the things which we should look at and tries to cover those people, because all these patients I'm talking about with cancer and so forth, they are probably going to Baragwanath, they are probably going to Grootskir or even universities in Bloemfontein, but they really they don't bank or save their sperm whatsoever.
Okay. So before we go on an ad break, doctor, I just have one question. Um, so as a woman who's had a child before and finds themselves now they can't conceive anymore, and they've gone through to the doctors, and it seems, according to the doctors, everything is fine. What would you attribute that to? Is it the diminishing X, or what would be the cause for
Yeah.
that?
That is actually a very common thing. I get probably 90% of the patient, which is actually where they say, no, I do my checkup and see the gynecologist. And then the gynae said everything is okay. Then when we go into details, it's not really true. There's a difference when you do a checkup for general checkup for gynae, which is screening, probably doing a cervical smear, doing a simple gynecological ultrasound, and doing some flu blood test, and everything comes normal. But for fertility checkup, it's a different process altogether. I say the first thing is start with looking at the men. Four things: the volume of the sperm, concentration of the sperm, the structure of the sperm, and lastly, the motility of the sperm. If that is okay with the men, we say the sperm is okay, and we don't need to do any other test except the screening. Then in a woman, when you do a fertility checkup, then you do an ultrasound. Look in particular at the fibroid, at the uterus. Look whether there are fibroids, there are polyps, all that sort of any growth in the uterus. The second thing, you go and look at the ovaries. In the ovaries, you look for the eggs, which you're talking about now. We call it antral follicular count. Then you have to look at that and see it. Then you can see that everything's okay. Then the last, you do the blood test, is called AMH. Then in that, it will tell you about what I just told you about, which the eggs which are diminishing, and it will give you a number. And then the last important thing, you can do either with HSG, with an X-ray, which look at the patency of the tube, both left and right, or you can do a laparoscopy and do what is called a lap and dye. In other words, you throw a dye and see that the fallopian tubes are open. Therefore, if somebody said I'm normal, in other words, all those which I've talked about, which are about 4 things, are normal, then there is what we call unexplained infertility. In other words, everything is normal, but this couple cannot get pregnant. Some of them, you'll do some few things. You'll say, you guys, I think you're working very hard, you're not doing anything. Maybe take a break and go to Devon or go to Cape Town or go anywhere and relax, Mauritius, for a week or 2 and see what's happened. Most of them, they'll come pregnant, those patients, stress related, become pregnant and come in. And unfortunate part about it, that those unexplained infertility, you can go and put them for IVF. They'll go for 6 IVF and they don't get pregnant. Why? Because this is something which they need to sort among themselves. Majority will be pregnant, as I say. There are few causes whereby you can say, now there's a difficult, let's say somebody's got cervical stenosis or has got cervical antibodies, which probably are taking the sperm in the vagina and cervix, and the sperm cannot pass. Then we can do something like IUI. In other words, you just pass the cervix and put the sperm just above there, and they become pregnant. Or then, can do IVF. As I said, most of the time is really not necessary. But most of them as well, they are young women which have something which is called PCOS, which, PCOS means that this woman, everything is okay. This woman is not ovulating. The IMH, I talked about the egg reserves, a lot of it. The eggs are there are many. But you can always see with an ultrasound on the ovaries that this woman is keeping all her eggs. She's not ovulating. That you call polycystic ovarian syndrome. Then as well, we treat those women with medication, and most of them 4-6 months down the line, they become pregnant. Therefore, in short, even what is called unexplained infertility, you have to go into detail. The first thing is the stress. The first thing is the lifestyle change, nutrition as well. And then if there's a need, then you can give them some few medication, and most of them, they will be pregnant.
All right, doctor. Thank you so much. We are about to go on an ad break. We'll be back with Dr. Jabulani Moloi, our fertility specialist from Joburg Fertility Center. Please stay tuned. We are coming back just now.
Let's sell on your behalf. If your item sells on our web shop, you pay a 10% commission plus the transaction fees, and you get the rest. Register now at www.shop.clevenard.com. Start uploading your product and services. We can really sell it on your behalf so you can carry on working on the things important to you. Are you looking to sell any type of product or service and you want to avoid the hassle involved? Selling can be an arduous and time-consuming process. At Clevenard Super Shop, we will be happy to take over the workload of promoting or selling your products or services. All you need to do is to register at www.shop.clevenard.com, enter your shop or vendor information, and then start uploading your product and services. We will do the selling. Now, be ready to get more sales and awareness. Start making more money from your business with Clevenard Super Shop by partnering with us today. Let's sell on your behalf.
Welcome back to Women of Authority Africa. We are with Dr. Jabulani Moloi from Joburg Fertility Center in South Africa. We are talking everything about infertility in men and women. Dr. Jabulani has given us so much in just the last 15 minutes. Some of the things I heard just now, I did not know they even existed. So, Doctor, I would like to ask about especially the IVF treatment. um, how is the procedure done, and is it painful, is it stressful, is it expensive, is it something that one would need to be diagnosed for, or I can decide I need an IVF because I've been trying for such a long time?
Yes. Yeah, IVF is actually a cornerstone of what we call assisted reproductive technology. In other words, if you failed naturally to become pregnant, then IVF will be the option. Now, there are indications which we can talk about of IVF. The first commonest indication is looking at if you've got any tubal problem. In other words, you've got a blockage of your tubes. In other words, the being blockage, it means that the sperm coming from the vagina through the cervix, through the uterine cavity, through the fallopian tube cannot meet an egg coming from the ovary. Therefore, there's a blockage in that route. Then the first actually invention of IVF, it was what we call a test tube baby, because then it means the sperm and the eggs have been taken, then combine them in the lab, then take them back into the womb. That's because of tubal problem. The second condition, which is very common, it may be something like endometriosis, may affect the ovaries, may affect even the tube itself, which cannot properly function, and therefore the sperm and the egg cannot meet. Therefore, IVF will be indicated. The third one is a resistant and failure of something severe, a PCOS, where it's not responding to normal treatment, and then you opt for IVF. The other common, it may be an issue where you've got fibroids, and those fibroids are obstructing the tubes or probably are in the uterine cavity, but you need to remove them first. Therefore, that can affect your chances of becoming pregnant. IVF and ICSI and their friends. ICSI is mainly indicated for men, but I'll discuss with it at the end. Therefore, if a man as well is got a low sperm count and it's got a low morbidity, movement of the sperm, it's got morphology as well, which is low, then IVF ICSI is indicated. Therefore, those are basic reason why, or a person with unexplained infertility, which we talked about. Those are the reason why we do an IVF. Now, how we do an IVF? After we've diagnosed and seen that IVF is indicated for you, then we'll go through a counseling and we'll properly explain how IVF is done. Now, IVF has got certain steps. I usually put something like 6 to 8 steps. The first step is a medical treatment. In other words, what we do, we take over your menstrual cycle with medication, and we stimulate you with injections or oral medication, so that naturally a woman produces 1 or 2 eggs every month. But now with IVF, we take that cycle and try to produce more eggs by using more drugs and nothing else really. What we use, we're using FSH and LH, which you have, we just inject you from outside. Then instead of producing 2 eggs, you produce 10 eggs, 7 eggs, or 15 eggs. Then that can take 10 to 14 days of injections. Then before we reach towards the end, when you're ready, the eggs, let's say size is around 18 millimeter to 22 millimeters, then we inject what is called a trigger. A trigger is nothing, it's like an LH in your system, which then trigger that the eggs, because the eggs in a follicle, they're usually attached on the wall. Then it will make those eggs to float in the follicles. Then that's the second step. Now after the trigger, then we do what is egg collection or egg retrieval. I think in UK they call it egg retrieval. Then what we do, then we go with an ultrasound. You are under anesthesia, and go with an ultrasound with a needle and go and punch out. Those eggs are almost, imagine something like a grape tree or a stalk with all the grapes. Then we puncture each and every one to take those eggs. And you are under anesthesia. Then the embryologist, then it's a medical specialist who specializes in looking at the eggs under the microscope. Then we'll take those follicle, which is fluid, and look for the eggs and put them aside. That's the second step. The third step, the embryologist now will ask for a sperm and fertilize the eggs with the sperm. Then if they are fertilized the following day, they go into what become an embryo or a blastocyst day 3, day 5. Then we then take that fertilized eggs by your husband's sperm back into your womb. We call that embryo transfer. Then we check pregnancy in 10 to 12 days. Then in other words, you'll be pregnant in the same cycle because you're going to miss the next cycle. Then that is called a fresh embryo transfer. Then if probably there are reasons that you cannot get the fresh, then we freeze everything. Then prepare you now the womb in the next month for you to be pregnant with your eggs. We can only give one egg if probably we are less than 35 to avoid the issue where you can have multiple pregnancy or even or even more than that. Then the second thing, we can do what is PGT, which is a screening of those eggs. Look at the chromosome depending on your age. Let's say we're above 35, we're afraid that it may be chromosome 21, Down syndrome, 18, 13, and all that. Then we can screen your eggs as well and look, they're very good eggs, then transfer them, after 5 days, 3 to 5 days after we've done a pickup. Therefore, it's all the steps which we go through when we do an IVF. Now, your question, is it painful? Yes, the time probably you get the trigger injection, when the eggs are coming out, we have more like menstrual pain, heavy pains like that. Then usually after the pickup with the surgery, there is no pain, although some patients do complain, but we give them some pain medication, but they drink it for a day or two, then they're okay. Therefore, basically IVF is not painful and it's very safe. The only complication we need probably to talk, and we're talking about 3 to 5% or even less of patients, they can during the stimulation have what is hyperstimulation. In other words, you're producing more eggs that can be 20 or so more. Then that woman then can go into ovarian hyperstimulation syndrome, which can be very, very a severe condition. But now we have, a lot of medication which we give, which is much more safer and reducing the chances of you having that condition. Yes.
Okay. That is very informative, Doctor. And also, I read about one of your treatments here, which speaks about reconstructive surgery when it comes to the fibroids being ruptured. How does that work in the uterus? Because some people suffer from fibroids and some are huge, and I've heard of stories that some become as big as a stone. So how does that procedure work when it comes?
Yes, fibroids or leiomyomata, it's a very, very common condition, and we're still busy now with the research. Probably we'll be through to find out exactly. In America and even UK, I think they have it affect almost 30 to 40% of women. But in Africa, it's actually the commonest condition. Therefore, it affects close between 60 to 80% of women. Therefore, it's a very common condition. It's very important. Hence, I'm more interested with it because it's affecting most of African women. Now, the fibroids, we got 3 types. We got the one which can be in the cavity. And if it's in the cavity, actually it's preventing you to get pregnant because now it's occupying the space where the baby is supposed to be. Then it needs to be removed. Usually we use something like a hysteroscopic resection to remove that kind of a fibroid. That procedure it's a procedure which needs to be done by a person who know how to do it, because it can be good and even dangerous. Because to do that procedure, you need to make the uterus bigger by getting more fluid in there. and that fluid will also get through the ovaries, I mean the fallopian tubes, and also in the blood into the patient. Therefore, there are rules to how to do it, but it's very important if you can do that procedure to help those patients. Then it's very important to do it, but it can be dangerous if you don't know how to do the procedure. That's one. The second one, you can have a fibroid which is in the muscle away from the uterus. Depending on the size in the uterus, sorry, depending on the size, it can actually compress the uterus, even compress both the fallopian tube and cause you not to be pregnant. Therefore, it need to be taken out. Then we use the laparoscopy. We call it laparoscopic myomectomy. It's also a procedure which can be done. Then the other one is it's a fibroid which is pedunculated or on the top of uterus, which really doesn't affect that much your fertility. But however, it can give you pain. It can as well twist, cause torsion, and then as well it can, if it's bigger, can affect your mobility of your fallopian tubes and make you to have difficulty to be pregnant. But all this, it can be done. I know the other medication which you can give to shrink the fibroid. Yes, you can do that. You can use that medication, but unfortunately, that medication only works for 6 months. Then after that, when you stop the medication, then the fibroid become big again. Therefore, it's not really a good treatment. It's very expensive and it's got a lot of side effects as well. Then there's a method which is used by radiologists, which I have to caution. It's actually a good method which can be used, but that method you cannot use for a patient which want to be pregnant. It's called uterine artery embolization, whereby they put a catheter towards the uterus, and then they throw some small pellets, which cause literally something like a blockage of the blood vessels to the fibroids. But what we have seen is that it doesn't only affect the fibroid by shrinking it, it also affect the inside of the womb. Then the inside of the womb tend also to be thinner, and then you have difficulty in getting pregnant because of that procedure. There are a lot of studies, but I'm also busy with one of those just to check and see whether it should. But so far, with all the statistics, it does show that that method is not a good method if you want to be pregnant in the future. Therefore, yes, fibroid is very common in African women. Yes, it needs to be treated. Not all fibroid, though, can cause infertility, but some can cause it because of the site and the size of the fibroid.
Okay, okay. So in African women, you would advise that they should go for checkups more, because they may not know that they have fibroids, which could be hindering them from getting pregnant.
Yes, I will encourage that they definitely should do more checkup, and they should get what is called a gynecological ultrasound. We should look at the uterus and look at the fibroids. And I would also say it's very important that when they get fibroids, not all fibroids need to be removed. But if the person has got difficulty in getting pregnant, or definitely has got a fibroid in the cavity, and some of them, they may present with what we call difficulty in getting pregnant. The most common as well, it may be very, very heavy menstruation. Some of the patients actually bleed so heavy with clots, and to an extent that they lower their HB. HB usually is supposed to be 13 and above. Then you get those women with a HB of 764. Then we have to actually to give them supplements and get the blood okay before you can go and do an operation. Therefore, that kind of fibroid may be actually even dangerous for just the quality of life of that woman. It's always tired, it's always weak, literally she cannot do anything because she's losing all the blood because of fibroids. Therefore, it's very important. And the other thing, it may be a pain. Now, fibroid can cause a few things. Sometimes can grow and actually oppress, or the urethra, to an extent that the ureter is blocked, and then cause kidney problems. It can actually even oppress the bladder, and the woman will complain that, what, every time I have now to pass urine, I don't know what's happening. It's there compressing the blood. Then it can as well grow to an size of 9 almost a 9 month pregnancy, where everyone said you're pregnant, but only find out it's a fibroid. It's very huge and big, and during the surgery, you expect that person to bleed. But it's very important to make a good diagnosis. I would say with fibroid, with a screening, it's better to catch the fibroid at a very early stage when it's still very young and I mean small. Then it can be removed with no problems at all. When, in other words, by problem, I think no bleeding, and the patient can be a 1-day procedure, and the patient can go home with no problems. Therefore, my approach as a fertility specialist is to really pick up the fibroids at an early, when it's still very small, and then remove it, and the patient can later become pregnant with no problem.
Okay, doctor. The other question that I have is in our society now, or mostly on social media, there's a lot of things that are coming up that are given to women for fertility. Some recommend drinking clove water with cinnamon and okra and mix all these things. Um, all these herbal medicines that are there, or let me just place them as herbal medicines. What role do they play mostly? Are they is it something that you would discourage or encourage, or it's something that can be done concurrently with also the medicine from the doctors?
Yes, I, I really don't have much information about herbal medication, but I do have some patients who have started to use them, and then to try to shrink fibroid, and after some time then it couldn't, then they come to see me, then we do operation to help them through. There are a lot of Chinese herbal medication which are there. People are using them for many other reasons. Some they do help them. And what I know, I've checked, especially when you're talking of ovarian rejuvenation. I think the Chinese got some few couple of medication which are herbal, which they say it's helping, and especially improve the quality of the sperm in men, and improve the shrinking the fibroids as they recommend, but I don't have experience with that. And the other thing is to also help with the rejuvenation and making the ovary, especially with patient above 35 now experiencing that the ovaries reserve is low. It's claimed that they are effective. Therefore, in short, I cannot comment much on herbal, but some do work. I haven't seen any bad side effect from them as well. Therefore, it's something which I feel I should look at as well and try to see whether it's helping. Because really, we are in Western medicine, that is true, but our fathers and so forth, they've used certain medication which we probably still now, I feel, need to be looked at, and then we can rather than pushing it away, we should express, let it be seen and be looked at, and then it may be helpful. I know, though, there are, especially for men, because I've checked that. For men, we've got two medication which is really traditional and it's herbal based, which improve the sperm count tremendously, especially the one medication from Peru, herbal. It's actually even culture, they eat that kind of a root there. And there's also one which is Indian origin as well, which is very good and helping men to improve their sperm count. Those one I've gone through the literature and seen and then look at the studies which have been done on those, which hence I say we should actually have open mind as far as herbal medication is concerned. And most of African people also have those medication, and then they've been pushed away. But I think it's time for them now to put them on the market, and we can see whether that is working. Because really a root or herbal medication is still the same like Western. It's just the Western one has been polished and put in a very fancy thing. They're also plant-based. That's my opinion.
Thank you so much, Doctor. And just before we close, I've got two questions, the last two questions. I have heard that the blood types of people can often cause them not to have children, or to have abnormal children, or to have children with certain conditions. How true is that?
Yeah, the blood group and so forth. It's not really true that it can cause a person to be infertile. It's not true. We've got all type of women who have difficulty in breaking pregnant. We have all type of groups as well of women with pregnancy as well with the time. I haven't seen any linkage between the type of blood, unless it's you're talking of certain genetic related condition which which can affect the blood. But from a blood group, whether it's AB or is BO or in so forth, or is positive or is negative, it really doesn't. The only thing I can say, it's when a patient have what is called a rhesus. In other words, if your blood type is positive or negative, which can affect your child. Let's say you are rhesus negative, Rh negative. So they say then you get pregnant, and then the man is rhesus positive, then a woman usually in that pregnancy can fight the baby. In other words, can develop antibodies, and then those antibodies cross through the placenta and then try to kill the baby, in a sense that they destroy all the blood in the baby, and the baby start, either going to what is hydrops or the swelling and the heart failure and so forth. That is the type of the blood which I know it can be very dangerous if there's that discordant. In other words, one is negative, the other one is positive. Then the other thing as well, it's a situation whereby a story about a blood group and an HIV infection, but as well is under research, we don't know, or which type. Some type said they cannot, turn positive at all, even they get exposed. Therefore, those are the few things I know about that. I can't comment more than that.
Okay.
Thank you.
And then the very last the question that I'd like to ask is, how do we encourage men to go for checkup of the semen quality and also the sperm count? How would you say we should make an awareness of such? Because it's becoming a problem, because women are the ones that are willing to go through, as I said earlier. How would you, um, as a doctor, maybe give us advice as to how do we put an awareness out there that men should actually go for semen quality checkups and all of
Yeah. And what I say for the first time is that we have to admit, and sometimes I'm reluctant to blame men for not doing some checkup, especially sperm count, if there's a problem. But I seeing a different, especially in fertility practice. I'm seeing more young men having, that, what, I want to start a family. I just want to do a checkup. Can you do my sperm count? It's very encouraging, but we see the younger group actually having a different mentality to us with the, because I think men of my age and above, they never have that even to go for urologists for checkup. But I'm seeing a change. I think it's more education based. Therefore, I think men still need to be educated about the sperm count. And I would say sperm count is actually the best, as well as a test to check your health. In other words, being a young man at around 25, 24, if you doubt something, go and do a sperm count. You don't get an injection or anything, then we look at it. Then that's very important. Also, for young men, we have to promote that smoking is very dangerous for sperm. The second important thing is also a lifestyle. I don't have any problem whatsoever with the chisanyama and so, but you have to take it to not to the extreme, because then you affect your health, getting weight, getting a big a belly and all that. Definitely that will affect your sperm count, and as well as alcohol consumption. Those are the things which we really have to teach men to go into. But believe me, young men who are coming 20, 30 years, I found it far different from us. I don't know why. In a sense that even with pregnancy, they are there to support their partner. Even with infertility, they start coming early with the partner, and they even offer themselves. I think it's more if we can get these men more educated. I think in the younger group, we're going to do better in Africa and above, because men now are aware of that. I don't want really to blame them, because I'm seeing a big change. It's a lot of change I'm seeing with time. I think education have actually penetrated us. And then if you remember South Africa in the past, really, men wouldn't like to go to a doctor for those, reasons, which that I don't want to eat this, I don't want to get this from those guys, this may happen to my life. Therefore, I think now things have changed and men are coming up and doing what is supposed to be done.
Oh, thank you so much, Doctor, for imparting such great knowledge to us. I believe we've learned a lot. I believe women out there, I'd like to talk to you about this. Hope is not lost. You need to go and check yourself. Go and check yourself. Go to a gynecologist. Meet a fertility specialist. It's very important because the stigma of not having children is quite bad. But you could find that your problem is not really that big. It can actually have a solution only if you find proper medical help. And as the doctor said, oh yeah, gynecological screening is not enough. You need to go for a fertility specialist to check the quality of your eggs, to also check your blood, and also make other checkups that are more than just go to a normal gynecologist. Thank you so much, Dr. Jabulani, for being with us tonight. You have been so informative. You have been so forthcoming with information. I didn't know that even before I was born, I already had eggs. I just, it was, that one is a shocker that by the time I'm born, I already have 10,000 eggs. So thank you so much for giving us your time, and thank you so much for imparting knowledge unto others. We appreciate you, Yusuf, for the work that you do. It must be very difficult to be a gynecologist and be a man as well. I believe there are some men who are very uncomfortable with their setup. So thank you so much for joining us tonight.
Thank you. I appreciate the invite. I really appreciate it. Thank you.
Thank you. Viewers, there you have it, another edition of Women of Authority Africa on Cleveland TV in Diaspora. We were talking everything about fertility and infertility in men and women. Do join us next time again, but I do urge you to sign up with us on www.cleveland.com or go to Google Play Store and download Cleveland TV, or you can alternatively watch us on YouTube. For the past shows, click Cleveland TV. You will find different kinds of shows, arts, we've got movies, we've got channel for kids, we've got blogs. You can go there and just join us. Thank you so much. Noluthando Ncizela Kalembede, Intombi kaXesibe, Umolokazana Wondima, signing out. Good night.